So welcome everyone. Thank you again for spending your lunch hour with us today. We're going to be talking about the 2019 legislative session, particularly the home stretch of that session. So a little bit about what's happened to date, and then a big focus on what we're going to be watching in the next 2 to 3 weeks as the session wraps up. So hopefully you are in the right place. Hi there, I think I just heard a little audio feedback, so please make sure to have your cell phone mute if you're not. Thank you. Okay, so hopefully you can see us on the webcam, but just to make sure that you can picture who is speaking with you today while we take our video off while we do most of the slides. My name is Allie Morgan. I am the Legislative Director at the Colorado Health Institute.
And hi everyone, my name is Eli Boone, Research Analyst here at CHI, and my first year on our Legislative Services team. Hope you're ready for some terrible baseball puns as we cover health policy at the legislative session this year. Also worth noting that our Legislative Services team does town halls and presentations to a bunch of different stakeholder groups. So if that's of interest, please don't hesitate to reach out. We'd love to come and work with you.
All right, so as Eli mentioned, prepare yourself for a bunch of baseball puns today. I'm going to take us off video so we can focus on the slides, but we will come back during Q&A at the end. And I should mention that we will save time for questions at the end. And so if you have things that you would like to ask, please either write those down or type them into the chat box. We'll do the best that we can to manage them. This webinar is also going to be recorded, and so we'll make sure to send it out so you'll have the slides and a recording if you love it so much that you want to listen again. And yeah, we're really excited to be here with you today to do an objective overview of what's happening. So here is lovely Coors Field. The Rockies may be at the very beginning of their season. I think they still have about 140 games to play. They have a whole glorious summer ahead of them, but our legislators are in a very different spot right now. They are rounding third and heading for home as the session comes to a close pretty rapidly. Here is a bad PowerPoint graphic that I made, full disclosure. Most of our graphics look better than this, but we thought it was funnier to leave it a little bit more, I don't know, what's the right word? Amateur. So you can get a sense of how much we love our designer, Brian Clark, who fixes most of our graphics. So we have Nolan Arenado from the Rockies here. I almost just made a hybrid team called the Bronchies from the Rockies to help illustrate what is happening right now in the legislative session. So Nolan here is representing legislators. These are state legislators who are sliding into home plate, which represents their hopes and dreams, everything that they are wanting to accomplish for themselves, for their parties, and for their constituents. However, they are working really hard to beat that throw coming in, which is the clock, and they are about to have potentially a pretty firm collision with 11:59 p.m. on May 3rd, which is the last minute that they are allowed by state law to be working in this session. And so there's a lot going on here, and we are going to include as many bad baseball metaphors and references as we can through the rest of our presentation. If you've ever watched a CHI presentation, you know that we like to start and end with 3 key takeaways in case you fall asleep or become overwhelmed by everything that we're about to share with you in the next 40 minutes or so. So here are 3 things to remember. One is that despite unified Democratic control of the legislature and the governor's office, and in many ways because of it, the 2019 session got off to a pretty slow start. Second is that the last few weeks will be anything but slow, so you should prepare for a sprint to the finish as legislators attempt to slide into home plate before that deadline. And finally, Governor Polis and party leaders do still have time to make this a highly successful session in their eyes for health and healthcare policy, but they are going to have to do a lot of work in the next 16 days to make that happen.
And before we get into all the policy that we're seeing go through the legislature this year, it's important to understand who's calling the shots, right? Who are the team captains and who's understanding what the makeup of the legislature looks like and who that leadership is and what their priorities are can often provide some insight into not only what direction the legislature is going to take this session, but also what future sessions might look like as well. So we can take a look at the General Assembly, or what we're going to call the clubhouse as a whole. We can see in the House, Democrats easily have control with room to spare. They only need 33 votes to pass the bill and can easily do so with the 41 seats that they currently hold. Now, that's not to say if a bill splits this party, it can make it a little more difficult, but just from party line, they have it pretty easy. And the Senate is a similar story, but they only hold a lead of 1 seat, or of 3 seats, so they can't be that far off base before they lose the 18 votes required to pass the bill. And the thing to note here is that things are different this year than they were last year. Democrats had less of a lead in the House, and Republicans controlled the Senate. So in many ways, it was a very new year in the clubhouse. And within the General Assembly, we now have new legislative leadership. Speaker of the House, Casey Becker, a Democrat from Boulder, was the former House Majority Leader, and Senate President Leroy Garcia, a Democrat from Pueblo, was the former Senate Minority Leader. Now, they both expected these promotions, and they were approved during the party's caucus elections held last year. And you can see the 2 chambers have majority and minority leadership here as well. Representatives Alec Garnett, a Democrat, and Republican Patrick Neville. And in the Senate, we have Democrat Senator Steve Fenberg and Republican Senator Chris Holbert. Like I said, it's worth noting that Becker and Garcia have been somewhat involved in health policy issues so far and healthcare issues, but neither of them has sat on one of the legislature's 3 health committees. Top priorities for Representative Becker that this group might be interested in include paid family leave and environmental health, while Senator Garcia has recently sponsored bills focusing on things like provider scope of practice. When we talk about new leadership at the Capitol, we can't go without mentioning our new governor, Governor Polis, who campaigned on a pretty progressive agenda. We're now 100 days into his new administration, but we can look at what we've seen so far. Governor Polis has signed a bill into law that would increase hospital financial transparency, and there's legislation around creating a reinsurance program as well. We'll cover that in a minute, but we also see a public insurance option bill. And the point here isn't that he's accomplished all of these things or that they will happen overnight, but that we're seeing bills that would address these issues. We're also seeing Governor Polis work towards things that would reduce costs, so things like out-of-pocket insurance costs, and bigger issues like reforming behavioral health. We'll make a shameless plug here. We have a blog on deck written by CHI's very own Joe Hannell, so be on the lookout for a blog about Governor Polis's first 100 days on CHI's website tomorrow. In past Polis's first 100 days, we also know he's swinging for the fences on some bigger issues as well. Polis recently unveiled his new roadmap to saving Coloradans money on healthcare, which is an ambitious mix of short-term and long-term actions. We saw some short-term progress on the previous slide, like passing a public insurance option, but Polis is looking beyond this year, right? He was just elected to a 4-year term and has time to accomplish bigger goals like expanding the healthcare workforce, increasing access to healthy food, and innovating care delivery. But he's also looking specifically at costs too, with goals like lowering hospital costs and the cost of prescription drugs.
Okay, so an ambitious agenda coming in, a lot of hopes and dreams going on, a lot of optimism. Let's look at how that looked at the beginning of the session and then a bit about what's actually happened. So going into the session, Democrats had experienced a pretty historic series of election victories back in November. Here on the screen, you can see the quote Fab 5 Democratic women who all won their competitive Senate races in November. Obviously, Governor Polis winning the governor's race relatively easily on the right. And so this change to single party control after 4 years of split legislative control has a huge impact on the session in terms of what parties can get done. The bill passage rate last year during a split legislature was about 59%, so still higher than a lot of people would expect. But Democrats came in expecting to use that single party control in the legislature and also Governor Polis in the governor's mansion to see that percentage of bills reaching his desk increase substantially. Speaking of the governor, even though they were both Democrats, Governor Polis and John Hickenlooper are pretty different people. He is very outspoken, he's more progressive. He also has served as a legislator in both at the state level and also in Congress representing Colorado. And so he was expected to be pretty hands-on in working with legislation this year, and I think that has proven to be true. We see this pent-up demand coming into the session for big policy changes from Democrats who had some wins and compromised with Republicans to see that happen in the past 4 years, but we're looking forward to having full control of the legislature in order to accomplish a lot of big things that they had been waiting on. And along with that, there was essentially a pile of bills that were in some ways ready and waiting for Democrats to pick up. These were bills that had been introduced in previous sessions and failed. And so even though they change a little bit from year to year, there were several bills that pretty much could have been picked up and run with this year. And so a lot of people were expecting to see major Democratic proposals introduced early on in the session and see that work kind of front-loaded. However, we've seen some curveballs and quite a few delays so far in the legislature. Some of it has gone as expected, and some of it has certainly not. And so just sort of a quick recap of the session, shameless plug of a blog that Eli wrote back in early March. We talked about the fact that halfway through the legislative session, we had not seen much, in fact, probably the majority of the really substantial legislation that had been talked about going into the session. It hadn't been introduced yet. And so that idea of having all of these major bills ready to go didn't quite materialize. The legislature and leadership has talked about working on the weekends potentially as the session winds down. That's not something that is typical. Some of that, according to Democrats, has been, according to Republicans, a response to the fact that they think Democrats have forced through a lot of bills, have not provided ample time for debate, and talking through bill details and including stakeholder input. And so Republicans have done things like demand that bills be read at length on the floor, which is allowed and has stalled debate for a pretty long time. There was a lawsuit by Republicans against Democrats that a judge upheld or ruled in favor of the Republicans, I should say, that the Democrats could no longer use computers to speed read those bills when they were asked to do it. And so there's just been a lot of back and forth, a lot of antics that have in some ways taken away from the time for actual substantive bill debate, many would say on both sides. And that has distracted in some ways from the actual policy conversations. And that leaves us at this point where there's been general consensus that legislators may now be running out of time to debate and decide on major policies when they have such a firm deadline coming up that they cannot exceed, even if they want to. And so to talk about why a lot of those bills have been delayed and maybe some of the things that have led to expectations being a little different from what's happened, what it really comes down to for Democrats is this. It is easier to window shop for an expensive item or to talk about something that you want as a concept than it is to actually commit to it, to figure out all the details, and to follow through on a purchase. And so I don't mean to be facetious in saying that, and it's also not that legislators didn't know this before. I think they're just really living this right now. Now that Democrats have the ability to get many of these major policies through, they realize that they need to really iron out all the details that wasn't necessarily required in past sessions if things were not necessarily going to get through. And so this is something that we've just seen playing out in real time. It's part of the legislative process. It's complicated and it's hard. And this year, there's been a lot of pressure on Democrats now that they're fully in control. There are lots of details to figure out, both in terms of policy changes and budgetary pieces, which are a huge part of the bills. This year has also brought out a fair amount of internal conflict within the wings of both of the parties, and especially the Democrats, because they're in this position now where they're in control of both chambers. Not all Democrats believe the same things or think the same way. And so there has been a fair amount of time spent trying to iron out those differences within their party before they're able to get legislation introduced. And so that's why we think we've seen so many bills coming later. That's not to say, however, that we haven't seen major legislation introduced this year. This has already been, I think, a watershed year for Democratic policy, including some health bills. And there is a lot on the table that has has really exceeded the level of major policies on the table that we've seen for quite a long time. So included in those are things like the red flag gun bill. You can see sponsor Tom Sullivan here on the right, major oil and gas reform. Both of those measures have been signed into law already, the red flag bill and the oil and gas reform. Measures that would be referred to voters to change TABOR, the Taxpayers' Bill of Rights, paid family leave, the National Popular Vote Compact that's signed by the governor, various election reforms, a repeal of the death penalty, and then a lot of health and insurance related things like a public option program. So we're going to talk in more detail about a lot of bills coming up, including things like bill numbers, but this is just to give you a sense of some of the things that have been on the table this year. This is not an exhaustive list, so it's already been a really busy year. A lot of this just got introduced much later than we had anticipated. And so where do we stand today? We have 16 days remaining. That includes weekends. And so there is not a whole lot of time. We're in the home stretch, bottom of the ninth, bases loaded. About 150 bills have been sent to the governor and have either been signed by him or are waiting on his desk. We're including approximations here because this is changing pretty much by the minute and will probably be outdated by the time that this webinar is over. About 100 bills, a little less, have failed so far in the legislature, most in committees. And so with 572 bills, I believe, as of this morning introduced in the legislature, that leaves about 300 bills still to be acted on and decided, either passed or failed, in those last 16 days of the session, which again includes weekends. We're seeing the calendar really fill up. We have seen incredibly long committee hearings. Hearing on the vaccine exemption bill on Monday, for example, went until I think 4 o'clock in the morning. Just yesterday, the House held third reading votes, which are final votes on 30 different bills in a single day, which is relatively unheard of. And so it is definitely crunch time in the legislature.
Great. So we saw in the chat box somebody was asking for bill numbers and said that those would be helpful. So we're going to dive into that right now. So a nice reminder that if you do have questions or comments, please throw them in the chat box. We'll get to them towards the end of this presentation. But as far as health legislation, we've chosen 4 or 5 bills for each area that we're going to focus on, and Ali and I will provide a quick summary for those bills, including the bill number. And like Ali said, just keep in mind that this isn't an exhaustive list, but it is a very big list, right? We've seen a lot of legislation, so we're going to cover a lot of ground today. This has been a heavy-hitting session, so, and that's in both in terms of the number of bills, but also what's been included in them. And we've put together a nice status key for you. So as we're going through legislation, they will be color-coded. Passed and signed into law, it'll be green. You can call that a home run for the bill. In progress or headed to the governor's desk, that's going to be in yellow, and you're going to see that for the majority of the bills we'll talk about today. You can think of these bills as either on deck or on base. And then bills that have been failed or postponed indefinitely, those will be in red. Call that a strikeout. Those bills aren't going anywhere. And yesterday was a big day for bills and appropriations. We saw less fail than expected. So like I said, a lot of those will keep that yellow in progress status. But all that being said, we can get started. Our first topic area is going to be behavioral health. Behavioral health was a priority last year, and it's been a priority again this year. The majority of the bills were introduced late in the session. So plenty of bills on deck here. First, House Bill 1120. This bill is concerned with preventing suicide. What it does is allows minors 12 years of age or older to talk to a licensed psychotherapist, and it has the Department of Education create and maintain a mental health resource bank available for the public to use. House Bill 1269, what we're going to call one of our major league bills, wants to make access to behavioral and mental health and substance use disorders just as easy to access as primary care under private health insurance and Medicaid. That's called parity. It's being heard on the House floor today. That's its first chamber, so it'll head over to the Senate after it's done in the House. And we've had a triple play of bills coming from an interim study committee on opioids and substance use disorders. Those three start with House Bill 1287. 1287, it intends to improve access to behavioral health facilities and medication-assisted treatment, or MAT. under the Department of Human Services. The second bill from that committee is Senate Bill 227. There's a large fiscal note here, but it aims to reduce overall harm caused by substance use disorders through a suite of options, including having some public buildings supplied with overdose reversal medications like naloxone or naltrexone, also allowing hospitals to be clean syringe exchange sites, as well as some other programs. And then finally, from that interim study committee, Senate Bill 228. This bill proposes ways to prevent future substance use through provider training, preventing providers from accepting benefits from pharmaceutical companies, and requiring some labels on opioid prescriptions so people are aware of the possible dangers that come with them. There's much more to that bill, but that's a high-level summary.
Okay, as you've already seen, there's a lot of orange on this list, so plenty of work for our legislators in the next 16 days. Let's talk now about energy, environment, and public health issues, which have kind of been worked on together or thought of together in many ways during this legislative session. We knew this would be a major area of focus under Governor Polis, so coming into the session, this was an area to watch. He's been no stranger to engaging in debates over energy. Expect this to be a bit of a wedge issue going forward. And so our major league bill to focus on here is Senate Bill 181. This was signed by Governor Polis just yesterday and is one of the biggest and probably the most controversial bills of the session. It creates a regulatory charge for the Colorado Oil and Gas Conservation Commission, imposes new requirements on oil and gas operations, and also gives local governments additional regulatory authority over oil and gas in their communities. Public health, welfare, and environmental health will now be more heavily prioritized as we talk about oil and gas in Colorado. And so that's something that many Democrats and the governor are pointing to as a big win for them so far. House Bill 1261 sets ambitious statewide goals for reducing greenhouse gas pollution and requires the Air Quality Control Commission to lead the charge to achieve those goals. And by ambitious, that means that by 2050, Colorado would have to realize a 90% reduction in greenhouse gas emissions from 2005 levels. And so that would be pretty substantial. That just passed the House yesterday and is moving on to the Senate. House Bill 1313 establishes more ambitious targets, this time for reducing carbon dioxide emissions from electricity generated by large utility companies. And those are defined as companies that serve at least 500,000 customers. They would have to develop clean energy plans as part of the process for them to reduce those carbon dioxide emissions, and smaller utilities could opt into this plan if they wanted. That had its first hearing today. And then 1314 in the House is another bill that is certainly worth watching. It would create the Just Transition Office as in a fair transition within the state. Beginning in 2025, that office would award benefits to coal transition workers who are workers who've been laid off, and provide grants to eligible communities impacted by the shift away from coal mining and coal-fueled power plants in Colorado. Benefits would include things like wage compensation and employment and training opportunities. That just passed a House committee yesterday, but has at least one more House committee to go.
And moving on, we can look at bills that are impacting insurance, and we'll start with House Bill 1004. This bill would begin to look at what a public option could look like in Colorado, and would have HCPF, or the Department of Healthcare Policy and Financing, and the Department of Insurance submit a proposal to the legislature about what that would look like in its design, how much it would cost, what the benefits are, and then an implementation plan and how they would like to see that happen. If this were to pass, we'd still be in the very early innings with public options, so a lot more to come here. Next is House Bill 1168, another major bill that would establish a reinsurance program within Colorado. The easiest way to think about reinsurance is insurance for insurance carriers. This bill saw some major revisions in late March, with the original design being unlikely to receive some necessary funds from the federal level. So they revised it, and now major hospital groups within Colorado are pitching in to help make it more affordable. House Bill 1211, this bill wants to make prior authorization requirements from insurance carriers more transparent for providers to use. Prior authorization requirements are when an insurance carrier has to approve a healthcare service to make sure it's covered by the patient's plan. Under this bill, hospitals that comply with these prior authorizations, a majority of the time could see less requirements and less prior authorizations as well. This is one of many bills that go on to add power to the Division of Insurance's commissioner. And we see in House Bill 1233, this bill looks at payment systems specifically and wants to reform them to reduce costs by increasing primary care utilization. And the main argument here is that a comprehensive primary care system can provide quality care and at the most appropriate time and yield net savings overall. Like with House Bill 1211, this bill gives that Commissioner of Insurance more say, and they would ultimately set affordability standards for premiums and also requirements for investing into primary care. And one last bill, one that scored, House Bill 1038. This bill was signed in early April by Governor Polis, and currently children who are qualified and enrolled in the Children's Basic Health Plan, or CHIP, they can receive dental services. And what this bill does is it expands that benefit and now allows pregnant women to receive that same oral health benefit as well. CHI published a report on this earlier this year around Valentine's Day, and we know that pregnant women are a vulnerable population, and access to these oral health services can avoid significant treatment costs and help fight other diseases later in life for both the mother and the child.
All right, moving right along, let's spend a minute talking about hospitals. Hospitals have faced a lot of scrutiny and been on the receiving end of a lot of finger pointing this session. That certainly, is not just that simple, but I think it's fair to say that hospitals have been on the hot seat in many ways this year. So another bill that has reached home plate already, been signed by the governor, is House Bill 1001. That was signed a couple weeks ago, but it was years in the making and really was the source of partisan debate in a couple prior sessions where it had failed, which I think made it all the more remarkable that that bill passed on the consent calendar in the Senate on its way to the governor, which meant not a single senator objected enough to even hold a debate on it in its final hearing. And so that bill is going to require HCPF and the Chase Board, which manages hospital provider fee funds, to prepare an annual report on hospital spending and uncompensated costs. Those reports will include things like financial statements, operating expenses, and staffing information. And the idea is that if we can better understand how financials look and how spending looks and staffing levels for hospitals, we may be able to have more constructive conversations about lowering costs. Another bill that is a formerly controversial topic at the legislature is House Bill 1010. This moved through without a whole lot of fanfare this year and is now just waiting for the governor's signature. It requires CDPHE to create a new health facility license for freestanding EDs, which will need that license to operate starting in late 2021. They'll also have to abide by some new rules. And among those rules are that FSEDs can't delay an exam or treatment by first asking about patients' insurance status or ability to pay. There have been lots of conversations around transparency and surprise costs for these facilities, and so this is an attempt to make sure that the cost conversations aren't front and center. Community clinics in rural communities and ski towns are, I believe, excluded from those requirements. House Bill 1174 is one of two bills this year that are addressing the issue of out-of-network services and surprise medical bills. This one has broader support, or seems to, from the outside, and has moved further along through the process, so it's the one we're going to focus on today. It's passed the House and is partway through the Senate, so it's getting pretty far along. That bill requires healthcare providers and insurance carriers to provide better disclosures about possible out-of-network billing situations. It also establishes set reimbursement amounts for out-of-network providers who are providing care at in-network facilities or in emergency departments. It also creates an arbitration process for settling billing disputes. And finally, on this slide is House Bill 1320. This was just introduced last week. When I looked last night, it didn't have a hearing date yet. It also doesn't have a fiscal note yet. It would set requirements for nonprofit hospitals in the form of multi-sector community board oversight, additional reporting on how their dollars are allocated, and submitting their community benefit reports would now have to submit their community benefit reports to the state instead of just the IRS, as is currently the case. The IRS doesn't always seem to do much with those reports, and some feel that existing community benefit requirements aren't really enforced, and so this seems like a way to address that. Also, apologies if you hear any background noise. There's some construction going on in our building, and so if you hear some hammering, that's not us.
And moving on from hospitals, we can talk about healthcare providers more broadly, starting with Senate Bill 201. Open discussions about adverse healthcare incidents has passed the Senate, where it was introduced, and is nearly through the House. What this bill would do would create what would be called the Colorado Candor Act. So following an adverse healthcare incident where a patient is either physically injured or possibly even killed, the Colorado Candor Act would create a confidential channel between that health provider or facility and the patient or their family. Now, this can't be used in a court of law, and the idea here is that it establishes good communication principles between those healthcare providers or facilities and the patient and their family. Oops, sorry about that. Senate Bill 234 is one of two sunset bills that we're going to cover today. Sunset bills are an opportunity to vote on the continuation of an existing program, but also allow for changes or amendments to that program as well. Senate Bill 234 is focused on professional review committees, which review and evaluate state licensed physicians, physician's assistants, and also advanced practice nurses for both competency and quality in their care that they provide. This bill was introduced in early April, but we haven't seen any movement on it yet. Senate Bill 193 is our other sunset bill. Again, we haven't seen much movement on this one either until last week, where it passed through its two Senate committees, but it's on its way to a third. This bill wants to renew the Colorado Medical Practice Act, which outlines most of the laws for practicing medicine in Colorado, while making some slight changes to it, like how long a physician with a pro bono license can practice within the state. And then finally, House Bill 1241 is focused on addressing the workforce shortage in Colorado's rural or frontier areas, which are defined by a population density. This bill would require the University of Colorado's School of Medicine to provide training and scholarships for students who commit to practicing medicine in one of the state's rural or frontier areas or counties that has a primary care provider shortage. Now, there is a fiscal note attached to this, and it would have some substantial costs, including things for the program itself, scholarships, and housing for those students.
All right, just a few more topical slides here. We know this is a lot of bills, but it's a busy session and there's a lot in the air. So pharmaceuticals are perpetually a big topic at the legislature. Eli mentioned reducing pharmaceutical prices as a big priority for Governor Polis earlier in the presentation. So this is something that we were expecting. It's also really complicated to do at the state level. And so it's a daunting task in many ways, but there are steps that states can take. So the first bill here is one that we heard was coming for a long time, but just was introduced a few weeks ago. The concept has evolved over the years, and this year it could be a pretty substantial policy change if it passes. It would require various new reports, including financial information from insurance carriers and pharmacy benefit managers, who are the ones who negotiate prices, and also would require disclosures from other organizations about gifts they receive from pharma manufacturers, PBMs, and insurance carriers. And then using that published information, insurers will have to reduce some pharmaceutical cost sharing for their enrollees. And so that is absolutely one worth keeping an eye on. It's passed its first two House committees, but has to get through another one before it goes to the Senate and the House floor. Senate Bill 5 was one of the first introduced this session, which sends a message about its importance to the party. It also was one of those rare bills that seemed to be ready to go, at least in terms of initial details, and so it was introduced pretty quickly the first week of the session. However, it's only halfway through the process so far. It's just about to start in the House. If passed, this bill would ask HCPF to move forward with designing and requesting federal approval for a wholesale importation program for prescription drugs coming from Canada. It appears to be limited to drugs purchased by HCPF, so those would really be for Medicaid enrollees. How to ensure safety and quality, and whether the Trump administration would approve such a request, which would be required, are big questions for this one if it reaches the governor's desk. House Bill 1216 is another bill that has to do with pharmaceutical pricing. It failed, or a similar version failed, in the 2018 session. This bill's pretty straightforward. It would prohibit insurance carriers from charging copays or coinsurance greater than $100 for a 30-day supply of insulin. which is a drug that's seen some exponential cost increases over the years. And the sponsor of this bill, Rep. Dylan Roberts, has a personal connection to this issue, which is a common motivator for legislators in terms of the legislation they carry. That passed the House yesterday with bipartisan support, so on to the Senate. Senate Bill 79 is yet another bill that is returning from the graveyard of failed bills in the 2018 session. It had a much better outcome this year and was signed by Governor Polis earlier this month, so a rare spot of green in this very long list of goldenrod. I don't know exactly what you would call that color. This bill makes electronic prescribing of most controlled substances, so that's things like OxyContin and fentanyl, required by providers instead of optional. This bill applies to a wide variety of healthcare providers, from dentists and podiatrists to optometrists and advanced practice nurses. It's an effort to better track opioids and other drugs through up-to-date electronic systems in the midst of this epidemic that Colorado and the rest of the country is struggling with. And then on the flip side, here is a rare bill that has struck out already. This bill didn't last beyond its first committee hearing. It's also failed in prior sessions and draws a really interesting mix of support and opposition that does not fall along party lines. This one would have prohibited insurance carriers from limiting enrollees' ability to select from any qualifying pharmacy. It also would have prohibited the carriers from adding fees or extra cost sharing on people who choose certain pharmacies. And so in the committee hearing, pharmacies and some patients testified in support of it. Insurance carriers were opposed. Was a split vote, but that bill ultimately did not make it through.
And when it comes to bills, as you've seen today, legislators can use them to accomplish specific tasks, but what they can also do is use them to study an idea or require future bills to have more notes or research as part of them. So we typically see a few of these bills each session, but wanted to highlight some that we've seen in this year's session. The first one, House Bill 1176, would create a healthcare cost task force. This would be made up of department heads and appointees by the governor. What it would do is look at current healthcare financing systems and what a public option could look like and how a multi-payer universal healthcare system would interact with insurance carriers. Now, it's worth saying that this report will be presented to the General Assembly in January of next year. So if this passes, we'll have to wait until then to see what they come up with. And similarly, Senate Bill 15 would create a statewide healthcare review committee that would take existing health committees from both the House and the Senate and have them meet twice in the interim between May 3rd and January of next year and see how healthcare issues affect residents across the state. This bill has 2 field trips for them to take, so they can really—
Field trip!
Yeah, so they can see how Coloradans are interacting with the healthcare system. House Bill 1184 would require Legislative Council, which is the research arm of the General Assembly, to include demographic notes as part of certain bills. These demographics can range from anything like race or gender to disability and age, geography, or income. Wherever there's data available, those can be included in these demographic notes. The Speaker of the House, the President of the Senate, and minority leadership in each chamber would each get 5 bills to select whichever ones they choose that would have to include these demographic notes. And then House Bill 1188 would also include notes in legislation beginning in 2020, but they would focus on climate change. In this bill, Leg Council would include whether the bill is likely to cause a net increase or a net decrease in greenhouse gas pollution from the point the bill is signed into law into 10 years following the bill's passage. So the real question here is if these bills do pass, if they'll actually have an impact on policy decisions going forward, or if they'll just end up riding the bench and we'll never really see anything from them.
Okay, and last but not least is a bit of a grab bag here before we're not done with the webinar, but we will go into the wrap-up information after this, just in case your head was starting to hurt from all the bill numbers. As Eli mentioned earlier, this has been far from a comprehensive list, and this grab bag doesn't include everything else we wanted to call out. But here are a handful of other health-related bills we couldn't help but mention today. House Bill 1239 would provide funding for outreach to ensure an accurate count of hard-to-reach populations during the census in 2020. Those accurate counts are really important for ensuring federal dollars, appropriate federal match rates, also things like our congressional representation. This bill originally asked for $12 million to support outreach, was recently amended during budget negotiations down to $6 million, still pretty substantial. Senate Bill 188 is the Family and Medical Leave Insurance Program, or FAMLI, F-A-M-L-I for short. This has been in development for many years. It's failed many times before in different iterations. Just passed Senate appropriations yesterday and goes next to the Senate floor for debate, and then obviously would have to pass the full House. This bill was opposed by the Denver Chamber, some other employer groups, which has led to a variety of amendments. In short, it would be funded by premium payments from both employers and employees and would provide partial wage replacement benefits for up to 12 weeks and employment protection for employees who take leave. Federal employees are exempt, local governments could opt out. This has a big fiscal note on it and is a huge policy, so keep an eye on that one. House Bill 1312 is about immunizations. Chances are you have heard about this one if you have tuned into the news in the last couple of days. It had a very long hearing on Monday night with more than 600 people signing up to testify. It's basically an attempt to make personal and religious exemptions from vaccines more burdensome in Colorado as a way to lift us out of our last place kindergarten vaccination rate among states, and that goes next to the House floor. House Bill 1032 has also drawn extensive testimony and debate and media coverage. This would add new requirements for public schools that offer a sex ed curriculum, doing things like adding definitions of consent and healthy relationships and human sexuality instruction. That bill is getting close to the finish line. It's passed the House and is partway through the Senate. House Bill 1322 is one of a variety of bills that deal with housing as an issue. It would transfer up to $40 million from the Unclaimed Property Trust Fund to provide affordable housing support. That could look like down payment assistance, loans, programs for homeless families, and repair or replacement of mobile homes. That one's up this afternoon in its first committee. Sorry, just dropped a piece of paper. All right, House Bill 1177 is the red flag bill, extreme risk protection orders. This one again has been signed by the governor just last week after failing last session. The bill sponsor, Tom Sullivan, had a personal connection to this. His son was killed in the Aurora Theater shooting, and so this was a really personal issue for him. That bill enables courts to require people to surrender their firearms for up to a year if a person is found to pose a significant risk to themselves or to hurting others. House Bill 1230 is one of the always large pool of marijuana bills up for debate in the legislature. We felt like we should include one. This would allow for the operation of legal marijuana hospitality establishments beginning in 2020. That could be clubs, hotels, retail food establishments, etc. That was up in the House this morning. And then last but not least, one that's gaining a lot of attention as it moves through the process is Senate Bill 235. This would automatically register people as long as they had complete records to vote when they sign up for services through HCPF, Human Services, or the Department of Revenue. So that's things like Medicaid and other public assistance programs. Currently, people are given the option to register to vote when they renew their driver's licenses. And so this would be a pretty big shift in the way we register people to vote.
Great. And so going into this session, we honestly thought it was going to be a pretty big year for health and healthcare, but much to our surprise, this hasn't been a huge part. Health and healthcare still make up a huge part of the state budget, but what we mean by it wasn't a huge year for healthcare, despite of all the bills that we've covered so far, was that we haven't seen a lot of big funding increases. Those have largely went elsewhere. It has been a big year for areas like education, both in terms of higher ed and full day kindergarten, which was projected to cost $227 million. Transportation has also earned a $70 million amendment. This year, there's been $20 million in set-aside funds available for both the House and the Senate, and that's a lot of money. It's more than we've seen in a long time, but still not nearly enough to fund everything we've seen waiting in appropriations. So think of all those yellow bills we've seen during this presentation. And this doesn't leave a lot of room for bills we're tracking with large fiscal notes. So things like family, medical leave, census outreach grants, and those 3 substance use disorder bills from the interim committee. Those each cost a few $1 million, with family medical leave costing a lot more. So we're wondering where money for all these programs will come from. And contrary to popular belief, the marijuana tax cash fund isn't a bottomless pit, so it can't cover all the other funding that they need. And when it comes to the cost of these bills, it can sound like a lot of money, but just as a frame of reference, the Los Angeles Angels just signed Mike Trout to the tune of $430 million. So it's all relative when it comes to the cost of these bills. And there is still time to make this a successful legislative session. But even though you have a Democratic majority, you can't get everything you want. So here at CHI, Ali and I sat down and we wanted to think through what it would look like for Polis and the Democratic leaders to feel like they've had a successful session. And we want to make it clear that this isn't what we think a successful session would look like for CHI. We really don't have a dog in this fight, but we think this is what success looks like for Polis and these legislators. So as a thought activity, if you think of this session as a single at-bat, we wanted to think through what a single, a double, a triple, or a home run would look like. And we're not talking about the importance of this legislation, but we are talking about how increasingly complicated, costly, and difficult to pass it would be. So for a single, we can see things like that freestanding emergency department regulation, or other things like transparency requirements. A double may look like passing reinsurance, or passing some legislation related to those surprise billing or out-of-network costs. A triple for the session could include things like parity, prescription drug costs, or passing that public option and seeing a study report that means it passes next year. In a home run, these are going to be those extra costly measures like that family insurance leave, substance use prevention that has to do with prevention, treatment, and harm reduction. So the question remains if Polis and the Democratic leaders will throw on their rally caps and have a strong finish. Like we said, there's time to do this, but what we want to do when we wrap up is hear from you and hear what you think a win for the Democrats and Polis might look like. Just to wrap up, also on the legislators' mind is an election coming up. You can't ever get away from the politics that goes along with the policy. And next year, we not only have a presidential election, but also an election where the entire House will be up for re-election, and so we'll have the Senate. So we think that this quote really captures the issue well. We know it's from Joey Bunch, a political strategist and commentator. He says Colorado's not a blue state and it's not a red state. And a lot of people might categorize Colorado as purple, but Joey doesn't think it's that either. We see Colorado as a swing state. So considering the blue wave we had last year, we do wonder with this election coming up and all of this grandstanding and campaigning we're going to see if Colorado will stay blue. And if it does, will these large healthcare policies come into play and pass? But if it swings the opposite direction, you know, we're interested to see what that'll look like too. So this is what legislators will keep in mind going into the off season. And that'll bring us to the end of our presentation so we can revisit our key takeaways. First, despite unified Democratic control, and in some ways because of it, the 2019 session is off to a low start. But that doesn't mean these last few weeks will be anything but slow. Ali and I are going to stay incredibly busy over the next few weeks as they wrap up this session. And then finally, Governor Polis and party leaders still have time to make this a highly successful session for health and in other areas as well. So we'll stay tuned and see what they have to do.
Great. So thanks for sticking with us. We know that was a lot of information. I think we've got about 10 minutes for some Q&A here. As you are putting on your thinking caps or starting to type some questions, you can find us on Twitter if you want to follow along with us or with the official CHI account. You can see our Twitter handles here. If you also want to see what happens with a bunch of this stuff when the dust settles in a few weeks, we always publish an end of session report called Legislation in Review. That should be on our website on or about June 1st. And so keep an eye on that. And we'll look at including what happens there. Okay, So let's have some discussion. If you can access the chat box, feel free to type any questions there. If we're not able to answer them, we're happy to take those down and get back to you if we can. If you have things to add, we know there are lots of bills that we didn't cover. If you have thoughts on Eli's earlier question, oh, I should put us back on video. Here we go. Hi, we're still here. If you have thoughts on Eli's earlier question about what do you think a successful session would look like, either for the Democratic majority or maybe for you or your organization, personally, we would love to hear that. So yeah, type away. We do have a comment saying that there is a sunset review of the Colorado Board of Nursing being conducted by CDPHE this year, not legislation, but a review. And so that's another one of those really good things to know and be aware of. There's a lot of stuff going on in health, and things like sunset reviews can feel really wonky and unexciting, but are actually incredibly important to pay attention to for policy. And so thank you, Amy, for throwing that out. We'll just give it another minute, see if anyone has questions or comments to share. I was looking at the Rockies record earlier today. They recently changed their Twitter handle to a rabbit's foot and all the O's in their name to four-leaf clovers to attempt to shake their recent loss streak. And I think it's winning. I think they just won 4 games in a row.
Right, yeah.
So looks like they're doing better at least. Maybe the legislature can capture some of that magic. All right. Well, oh, there we go. Can you take that one? Start?
Yeah, it looks like we're having a couple of questions coming to the chat box, so thanks for throwing those in there. The question is, which bills do you think will come back next year? And it's a good question. I'd be hesitant to make a guess with all the bills we have in progress left in the session and in the time we do have to make them happen. I don't know. It's a good question. Allie?
Yeah, it depends a lot on what happens in the last 2 weeks. My big question right now is, are there bills that probably have the support there but are just going to run out of time for debate? And so I think we'll be able to answer that question a lot better in like another 16 days,
right,
plus or minus. But definitely things like family, those SUD bills, prescription drug, cost requirements and things like that. If they don't feel like they have the time to pass those policies in the way they want, they may have to table some of that stuff and come back, but I don't know about specifics. One I will throw out that I think will come back is a bill to repeal the death penalty. That failed earlier this year, and legislators basically cited a lack of time to have appropriate debate and discussion over that. So that's sort of a health adjacent bill, but that's definitely one that I'd expect to come back.
And I will just add that normally what you see is when you have split party control, that's what's usually will cause a bill to come back this year, or will come back in the year following. But this year with Democrats controlling both chambers and the governor's mansion, it seems like what we'll see come back are bills that just haven't had that time to be fully thought out, or that they don't have the budget to do. So, yeah. Yeah. Great point.
Valerie had asked to see the slide about behavioral health again. You're welcome, and we'll be recording this and sending it out. But if there's anything that we went through too quickly and you'd like to see again, either chat here or reach out to either of us by email or on Twitter, and we're happy to send you slides. Mm-hmm. Is there anyone who'd like to share what they think would be the single most important bill to pass to make it a successful session, either for you in terms of your own personal priorities and background or the organization that you're working for? Is there that one really important bill that you're championing this year? And if you can't choose, that's okay, we understand. All right. Well, we'll give it another second if there's anything else.
Oh, looks like we have some. Reinsurance, we see that in the comment section. Looks like to be a big bill. Same thing with out-of-network billing or surprise billing. House Bill 1312 would be a big one personally. That one. I should know what that bill number is, but we have been so behind. Monica, would you mind sharing what that bill title is?
we've got some of these immunizations. Thank you. I knew that sounded familiar. Yes, the immunization vaccine exemption issue is a huge one. So all of those, reinsurance, out-of-network billing, are things that are definitely on our watch list at the top. Thank you all. Well, I know that it has been close to an hour. Oh, we have one last question, and then we'll wrap up. Supreme Court, as an FYI, will hear oral arguments in a case related to the 2020 Census citizenship question on April 23rd. Thanks, Amy. That's a really good thing to know. The census is an issue that we have been tracking closely. We talked about that one bill that would allocate now $6 million to outreach efforts. CHI, again, doesn't take positions on any legislation or candidates, but we did write an op-ed recently in the Denver Post just talking about how important an accurate census count is. It's data that we use every day, that I'm sure a lot of your organizations use every day. It's important to ensuring that we get the right amount of federal dollars and an accurate count. So that's definitely an issue that we're watching closely. So thanks for that heads up. Okay, we're going to let you guys go just a couple minutes early. Thank you so much for tuning in. We hope this was helpful. We are always open to your feedback and questions and any follow-up that you have. So feel free to reach out to us again, email, Twitter, phone. We're available, and we really look forward to continuing to work with all of you. So
thanks so much.
Thanks. Have a good rest of your day, and wish our legislators luck in the last 16 days.
And us too.
And us too. Thank you. Bye, everyone.